ED Discharge Workflow Masterclass. Before Helen starts, just a couple of points I want to make. If I can just everyone to keep the cameras off, that's great. And also, if you've got any questions that you want to ask, if you can put them into the chat, then what we would then do, we will download the questions and we will put them on the QRG and we will send links out to the questions with the answers either later on this afternoon or early tomorrow morning. And then that way we can sort of like run through. So any questions, pop them in the chat and we will get the answers to you. Other than that, thanks for your time. Thanks for joining. We apologise for earlier on. It was apparently a Microsoft issue and it affected it quite nationwide by all accounts. So apologies on that one, but we're ready to go now. So I'll hand you over to Helen.
Good afternoon, everybody. I'm just going to share my screen with you now. Just a second. Okay, so through this Discharge Masterclass today, we're going to be using the FirstNet app, and I'm currently in the All ED Launch Point screen. I've got my patients set up in my patients tab here. And what we're going to do for the session is we're actually going to go through 4 different scenarios of how you would discharge a patient, because we're aware there's a lot of scenarios that go on in this department. So just to give you a taster of the different ways you can do a discharge. So first of all, the scenario that we're going to work through is a patient that's in an ED or SDEC area, and you are transferring them to an inpatient ward. This scenario can also include the discharge lounge as well. So I'm going to start off this one with this patient here. So first of all, the first action that you will need to do is a decision to admit. So within the patient information box, if you right click in here, and then if you scroll down to patient management and then into ED decision to admit. It will come up with a box that will say this conversation will admit your patient as an inpatient. Do you wish to continue? Yes. And then fill in all the yellow mandatory fields. So ideally, we want to be doing these things in real time. So I'm going to put in a T for today, that puts in today's date, and an N for now to put in the current time. The next bit that I will fill in is source of admission. So this is asking where has the patient come from. So I'm going to say usual place of residence. Then it will ask you for the clinician details. Just bear in mind that if you're unsure of the clinician details, your coordinator should give you guidance and a spreadsheet with those details on. For this scenario today, my patient has a UTI, so I'm just going to go with a urology consultant. There we go. So I've put in my lead clinician details and I click OK. And what you will notice once you've completed this action is that the status over on the right-hand side turns to admission. The next action that you will need to complete is a bed request. This again is done by right-clicking in the patient information box, but this time you will select transfer patient location. Here it will bring you to the requests page, and you'll notice here there's a blue circle with a white cross through it. That means there's missing mandatory fields that we need to fill in, and these are all collected in this button down on the bottom left here. So I'm going to put in where I would like my bed request to be for this patient. So for this scenario, I'm going to go with an AMU. So just pick a medical option. And my preferred ward, I'm going to pick AMUA. Gone past it, there we go. And sign that off. Again, your status over on the right hand side in the ED launch point screen will update with those details as well. Once that bed request has been done, what it does is it sends a message to the system MyFlow, and that's where the bed management team can go in and allocate a bed for the patient. You will notice on this test patient down here that their bed has been allocated. I know this because the bed details are filtered through into the patient details here. So I'm going to continue this scenario on this patient. So to finish off the process, I need to click on the patient's name. And then first of all, I need to move to my ED clinical information tab and make sure I've filled in all the relevant details for the patient. What I will then need to do as a doctor is fill in an ED clinical note. So I've clicked on that there now. I can review the details on the screen. And then once I'm happy that all the details are there for the patient, I can sign and submit, and then sign again to save the document in the patient's record. You may also feel as a nurse that you want to complete a handover or an S-bar note at this point as well. Once this is done, we can move over to the ED discharge workflow and work through the menu over here on the left-hand side. You will notice some options are highlighted by a red star. That's because these are mandatory, but don't forget about the other fields that also need filling in, such as clinical narrative, plan and requested actions, discharge information and advice given, for instance. Also, another one that definitely needs filling in is the diagnoses and problems. You'll see here on this patient, there has already been a diagnosis of a UTI. So now I'm going to fill in the mandatory areas. So the first one is the ED treatment form. So I've selected it here on the left-hand side, and then to access the form, I need to click on the drop-down menu here, the arrow, and then select it here, and it will bring up the form. Then you will put in what investigations your patient has had. So I'm going to say urinalysis. And then treatments, I'm going to say they've had some fluids as well. And then once you've filled in all the details, green tick to save the information. You'll also notice a green tick appears on the left-hand side as well. Following on, we now move to the ED discharge information form. Again, click on the drop-down arrow to access the form. And for this one, I'm going to say treatment complete. And then the discharge destination will be ward, physical ward, bed outside ED. I won't know the outcome of the follow-up, so I'm going to say no referral, and the patient won't need a copy of the ED discharge letter. This patient has breached, so I need to put in my breach reasons. So I'm just going to put in trust patient flow for now, and green tick to save the form. You'll notice another green tick appears on the left-hand side. Now I'm going to move down to discharge medications. And this time, instead of finding the drop-down arrow, I choose the status options over on the right-hand side. Because I'm transferring my patient, I'm going to pick cross-encounter transfer. This is so that any drugs that have been prescribed within ED, they'll be able to see that in the area they are being transferred to, and if needs be, they can follow on as well. So there you can see my patients just had paracetamol. So I continue that and click the transfer in the bottom right-hand corner. That's my discharge medication option complete. The next one is person completing record. Again, we access this using the drop-down arrow. Here it's just asking for who is signing off. So just put in your role or grade and your ID. We also have the ED CRAT, and I'll just do this one as well. And this form isn't applicable for our patient, so I'm going to leave it as it is and green tick that. Now that all those elements are filled in, what I then need to do is generate the discharge letter. So for this option, I'm going to pick the RBH ED Discharge Summary. Review the letter, and if you are happy, sign and submit, and then sign again. Now we're ready for the last action. So for this one, we move down to the end visit option, and we pick patient leaving ED to be admitted. When we are transferring a patient, because we are using Maya Flow, the bed that was allocated that we spotted on the ED launch point screen, you will see they are displayed here. What you then need to do is translate that information into the receiving details just here. So we are on level 1, so I'm going to move this to level 3 to find C2. And then put in my bay, and then hopefully I'll find my bed, bed 21. There we go. So that's my transfer details filled in, and then I just put in T for today and N for now. Click OK. Put in the transfer reason. So I'm going to put in transfer from ED. Click OK again. Sorry, a little bit of a technical glitch there. There we go. You'll see we've now got a green tick to show that we have now transferred that patient. If I move back to the ED launch point screen now, maybe if I refresh, you can see now that that patient has dropped off my list and has moved on to that C2 area. So that's the first scenario done. So we will move on to the second scenario now. With the second scenario, this is for a patient that's in the ED area and we want to transfer them to an SDEC area. So I'm going to do this on this patient here. So the first action that you will need to do is make sure all the details are up to date for your patient. So this is a good time to, again, create that clinical note, or in this case, I'm going to create an SBAR note so that all that information is available for whoever is taking over their care in the SDEC area. So I'm going to click on the patient's name and move into the patient's record. And then I'm going to move to the handover tab. And then as I scroll down to the handover tab, down at the bottom, I've got a nurse handover SBAR note that I can create. I can review the information, sign and submit, and then sign again. Once I'm happy that all the documentation is complete, I will move back to the ED launch point screen, and then I will need to refer to that SDEC area. So now I'm going to do a right click again, and this time I'm going to select ED referrals form. Oops. There we go. So for this scenario, I'm going to say that I am moving them to the SDEC area, ambulatory care. So I'm going to select ambulatory emergency care. My specialty will be medical. And then here is where I can put in the reasons for the referral. Once I've done that, I'm just going to refresh my screen again. You will notice a phone symbol will appear here. If you want to check the status of the referral, if the SDEC area have accepted it, hovering over this will show that status there. So it's currently showing as ordered. Once they've accepted it, that status will update again. What also happens with that referral is it goes across to ambulatory care. It appears on what they call an MPTL list, a multi-patient task list, and that's where they accept it from. So they are aware that your patient is coming to that area. Once this is done, we then need to move back into the patient's record and then back into the ED discharge workflow. And again, you work through the ED discharge workflow menu to fill in all the details for the patient. So I'll just quickly do this again because this is very similar to how I've just shown you with the ward transfer. When we get to the ED discharge information form, you'll pick slightly different options here based on the scenario that you have. So the discharge status here, I'm going to pick stream to ambulatory emergency care. My discharge destination is ambulatory care. And again, for the discharge follow-up. Same with transferring to a ward. When I get to the discharge medications option, I pick cross-encounter transfer again so that that medication information can pull across with the patient's details as well and continue if necessary. Then I'm just going to do person completing record again. And then for this patient, I'm going to generate another GP discharge summary letter. So I'm going to select this option. Again, review the information on screen, sign and submit, and sign again. And now with my end visit option, I'm going to pick this one, discharge from hospital, transfer to SDEC, transfer outside of trust. So I'm going to pick stream to ambulatory care service and then click OK. I've got a green tick again, and that's my transfer to SDEC process complete. I'm going to move back to the ED launch point screen now and work through the third scenario. So with my third scenario, this is for a patient that's had a bite or sting. We want to discharge them home, but we also want to prescribe them medications from the medicine cupboard that is used within ED. So for this one, I'm going to use this patient here. So once all my documentation is complete on my patient, I'm going to move to the Quick Orders tab. I can also do this from New Order Entry if you prefer, but I'm going to do it from here. I'm going to search for the drug that I want to prescribe. And because it's going from the medicine cupboard, I'm going to type in TTO. When you type in TTO, you will notice there's lots of plans that appear. So I'm just going to pick the one for the area that I'm in. So I'm going to use this one, UCC RBTH TTO medicine cupboard. Once I've selected that, you'll notice it appears in the basket over on the right-hand side. And then I'm going to modify the details. All the drugs that are listed within that medicine cupboard will appear on screen. So for this scenario, I'm going to prescribe my patient some flucloxacillin. So I select it here and tick it. Then I select my order sentence. So I'm going to go with 1,000 milligrams. And then I fill in all the details for that prescription. So I'm going to say it's a 5-day duration. The indication is a sting. And then I'm going to click orders for signature. And then I'm going to sign that off. What then appears is an ED prescription form. So I'm going to say yes to this. And then you will see this question here, which is mandatory. Where should the patient get the medication dispensed? So for this, I'm going to pick clinic ED nurse to supply. And then I can put in an extension number there. Green ticket to sign it off. And then, like we've done before, we move to the ED discharge workflow. Fill in all the details. You'll see I've already done it for this patient, except the only one I haven't done is the discharge medications, and that's because it's a slightly different process. So I click on discharge medications, and this time I select the discharge option over on the right. You will see here I've got my flucloxacillin that's pulled through there. I click sign. A little bit of a glitch there. There we go. You'll see the ED prescription form pops up again. So I'll say clinic ED to supply. There we go. And that's the discharge meds done. What you will then need to do is move down to the create note section, but this time you select the top option. So these are two forms or letters that get generated one after the other. So if I click on this, first of all, I get that prescription note. So I sign and submit that. Sign again. Then I review the discharge letter, sign and submit that, and sign. And then what I can do is, in order to take that and give it to the nurse, I'll just refresh a moment. I go to documents, and then from my documents tab, find the prescription and print it off from here so that can be dispensed by the nurse and the prescription details put in the basket like the process is currently. Once that's been printed off, we can finish off the discharge process. So we end the visit. So discharge from hospital. There we go. We've got treatment complete, usual place of residence, discharge follow-up. Click OK. And that's that scenario complete. I'm now going to move back to ED launch point for the last scenario. So with this one, it's very similar to the one that we've just had, but this time the medication is unavailable from a cupboard. So it would need collecting from the pharmacy. So I'm going to do it for this patient here. So back into the patient's record. I'm going to go into quick orders to order the drug that I want to prescribe. So this one's for angina. So I need to select the correct one, but you can see I've not got the exact one that I want at the moment. So I'm just going to go with the generic one, and then I can fill in all the correct details. So now that I've selected that, it's gone into my basket here. modify details, and then I'll fill in all the mandatory fields from my mission required details button. So my dose is 2. My dose unit for this one is going to be puffs. Route of administration is going to be sublingual. Frequency as required. PRN, we'll put breathlessness or pain. Indication, angina. Give additional dose now, no. And then my drug form is a spray. So fill in all the details that are necessary for the prescription and sign. And then we're back into the ED discharge workflow. So they're all filled in again. So back into discharge medication. And this time back into the discharge option. Sign. But this time it'll ask for slightly different details. So admission bed, no, and then we want the GP to continue and review. Sign again. Your ED prescription window will appear again. So yes, select the correct option. So this time you will take this prescription to the hospital outpatient pharmacy, put in your extension number again, green tick, and that is complete. And then just like the previous one, we would generate the discharge summary and pharmacy note and print that off again. And then we would complete the discharge home as we did in the previous one. And that would complete that scenario. So that covers everything for our discharge masterclass within ED today. Thank you for listening.
Thank you very much, Helen. I'm looking at the chat. There's not many questions in the chat. I think probably it's covered most of the questions, I'm sure. If you do have any questions, just put them in the chat and we will pick them up afterwards. Becky will get the video sent out and any questions that have been answered out to you guys. All the links will be sent as soon as possible. But again, many thanks for taking